Hi, my name is Tim Reha here at Informed Health 2016 in beautiful San Francisco at UCSF. Special guest today is Arien Malec with RelayHealth, and you have a really interesting background, but welcome to the show.
Great, thank you so much. I was super glad to be here.
What is your background?
Well, I have been in life sciences and healthcare for quite a long time. I've been in health interoperability, trying to drive patient engagement and drive better information to clinicians for about 10 years. And I also had a stint at the Office of the National Coordinator, which is the Office of Health, U.S. Health and Human Services, that is coordinating the adoption of health information technology across the country. And I was very pleased and privileged to be able to help solve some major interoperability problems for the country while at that role.
So the topic today was health information interoperability and the holy grid. Who was on the panel and what was happening inside?
Well, we had a great representation of general technology, folks from Cisco, clinicians who were representing the clinical point of view and the point of view of integration, digital innovators who were looking at, from a technology perspective, how to advance the cause of interoperability, and I was really representing the policy side of this from my background at ONC and my current role as co-chair of the Health IT Standards Committee.
Where are we at in interoperability? I've been to the HIMSS conference and all these different conferences, and it seems like it's always a topic, but with all these different types of systems in place, it seems like we're still working on it.
Sure. The way I described it is that it's a little bit like Charles Dickens. We're in the best of times and the worst of times. We're in the best of times in the sense that objectively we have more interoperability now than we ever have before. There's more data flowing to more places than in any other time in history. At the same time, providers of care are more frustrated. Policymakers are more frustrated about interoperability than they ever have been before. And so one of the questions that I was posing is, how could both of those things be true at the same time? Yeah. And the answer is that a lot of the interoperability standards that we developed were developed back in 2003 and earlier for a different era, an era where we had 20% adoption of EHRs, an era that was pre-iPhone. And now we're in a world where we have close to 90%, almost, reaching up to ubiquitous adoption of EHRs. We're in a post-iPhone era. We're in an era where interoperability in the consumer space and the web space is ubiquitous. And the good news is we're now building interoperability methods and approaches that drive interoperability that is at web scale and matches what we have in our iPhones and our Android phones, which is the ability to pull down and modularize the applications that we use instead of using everything built into the EHR. The bad news, if there is bad news, is that everything in healthcare takes a long time. These are big, massive systems that are being used to drive patient care. So we're moving in the right direction, but it's going to take a little while for us to roll broad-scale interoperability out. The other point that I raised is that in every other industry, it's been large consortia that have a built-in, they're swimming with the grain of their economic model, swimming with the waves of the current of their economic model. And so you've seen this in Wi-Fi. There's a great analogy today about digital cameras and moving from a world where you have to buy the software that comes with your digital camera to using whatever it is that you have, whether it's iPhoto or the photo app that you want to use. And the reason is that camera makers realize it's better for them to deliver a better consumer experience, so that their customers can use a wide range of tools, and they're going to concentrate on building the best lenses and building the snappiest shutter speeds and those kinds of things, building the attributes that they're really good at. I think we're now in an era where value-based care is driving hospitals and health systems to invest in total patient care. EHR vendors are starting to think about the approach to making sure that their big iron systems are the best at what they do, which is clinical workflow, and that we move to more of an app model that has interoperability built in. So I'm very hopeful for the future, but also recognize and want to caution people that good things in this industry take time.
Tell us about RelayHealth.
We are a division of McKesson. We do interoperability, data acquisition and aggregation in order to drive better decision making for large healthcare institutions, oncologists, and the like, and in particular to be able to use that data to drive upstream analytics for population management and financial decision support. So we're really in the weeds in this area of interoperability. The better interoperability is, the more we can show our customers who are providers of care better analytic tools that help them lower costs and deliver better health.
What types of folks are you trying to connect with here or out there in the world to, for partners or to help you guys move your business forward?
Yeah, so I'm wearing two hats. One hat is a policy hat as a co-chair of the Standards Committee, really trying to get the message out about where interoperability is in this country and make sure that people have an awareness, and also make sure that people are participating and actively using their sweat equity to drive interoperability in this country, really standing up and getting the job done. As McKesson and RelayHealth, I think we're always looking for innovators who have made major progress both in the area of analytics and as well as in the area of data acquisition and aggregation and better use of data. And then we're clearly looking for partners who recognize that interoperability and data acquisition is a hard problem and yet need to solve that problem in order to drive the business value that they're looking to as health systems.
Nice job. Thanks for being on the show, Arien. And how do people get a hold of you, Arien?
You can look me up at LinkedIn, Arien Malec, or you can follow me at Twitter at amalec, AMALEC.
Well, thanks a lot. It was fascinating to connect with you and look forward to kind of seeing your work in the future.
Perfect. And I want to thank UCSF for inviting me to this really fabulous conference. A lot of great information was discussed here, and I think it's a good leadership position for UCSF to drive healthcare innovation.